And now I'm going to go live. And, okay, let's see. Okay. All right, let's go live.
Is somebody monitoring the Facebook?
Okay, we're live now. Oh, okay. All right, we're live, so welcome everyone. And if someone can just make a comment, please, to let us know that we're live, you see our picture fine. We'll just wait for a few seconds to make sure. And if any of you guys have Facebook open, if you could take a look, which is what I'm going to do right now, because I don't want to get started without knowing that we're live. Okay. All right. We are live. So, hi everyone. My name is Ruth Nasrullah, and I'm the co-founder of COVID-19 Wall of Memories. And I want to thank you all for being here today as we reach 1 million people in this country who have passed away from COVID. It's almost unbelievable. It gives really a different sort of flavor to this episode of Read Their Names. So I thank you all for being here, and I thank the people who have chosen to read names today. And with that, I'd like to turn it over to the founder of COVID-19 Wall of Memories, my husband, Mohammed Nasrullah.
Thank you, Ruth. My name, as Ruth said, it's Mohammed Nasrullah. I'm the founder and the president of COVID-19 Wall of Memories. Um, our country has reached this grim milestone of losing 1 million people, million fellow countrymen to this terrible disease. And we at COVID-19 Wall of Memories feel that we cannot just let this sad milestone pass without doing something to remember and honor all those folks that we have lost. So today we are doing this, read their names. This is the third time that we are doing it since we started COVID-19 Wall of Memories. This is just a small gesture towards honoring all the people, all the Americans, all the fellow countrymen that we have lost to this pandemic. So basically what we are doing here is our volunteers or board members and some of the folks, family members who have lost loved ones will be reading the names of the people that we have honored on our wall of memories. So we'll just read their names. Thank you. Thank you, Ruth.
Yep, and Mohammed, you will be the first to read the list of names that you have, please.
Okay, so here goes. It's Abdul Fattah Abdurrabbu, age 65, Canton, Michigan. Frank Kozum Jr., age 81, from Triangle, Virginia. Patricia Ann Del Valle, age 69, Lakeport, California. David F. Gutierrez, age 52, Tomball, Texas. Margie Alexandra Pisa, age 39, Alvin, Texas. Kevin DeJohn Smith, age 48, Riverside, California. Randolph Winstead, age 94, Williamsburg, Virginia. Erna Winstead, age 94, Williamsburg, Virginia. That's all I have, Ruth. Thank you.
Thank you very much, Mohammed. And I just wanted to note that the two people you read at the end, the Winsteads, are a married couple. And unfortunately, that's a phenomenon that we have seen, which is couples who passed away both of COVID. So that's one of the things that we've noted as we've honored people on our wall. Next, we will have Lisa. If you could please read your list of names.
It seems that they have a couple names that he read, but I'm going to go ahead and read what I have.
Okay.
I have Joni Bentley Bartley, age 29, Pikeville, Kentucky. Valentina Blackhorse, age 28, Kenyatta, New Mexico. I have Sergio Galicia, 63, Katy, Texas. I have David Gutierrez, 52, Tomball, Texas. I have Margie Alejandra Pisa, age 39, Alvin, Texas. Vida Corazon Ryder, 47, Delaware, Ohio. I have Vida Corazon Ryder, 47, Delaware, Ohio, and Ruthie Lee Willis, 65, Clarksville, Tennessee. And that's the end of what I have, names I have.
Okay. And did you want to also mention Alec?
I'm sorry, yes. And my son, Alec Lee Witten, 24, Pasadena, Texas.
Thank you. And of course, we have Alec's photo behind you. So, and he is also honored on our wall. All right, Harriet, if you'd like to go ahead.
Sure. Thank you. Good morning. I'm in Rochester, New York, and I'm going to read names of people from Rochester, New York. First is Patricia Barone, age 70. Next is Gladys Goldstein, age 100. And where I have some occupational information, I'm going to read that. And with Gladys, it's interesting that she was a bookkeeper and she was employed in the controller's office at Forest Pharmaceuticals and retired at age 91. Next, Stanley Hatchman. Pharmaceuticals and retired at age 91. I'm hearing feedback from Facebook. Stanley Hatchman.
Can you mute?
Mine isn't on. Yeah.
Okay. Does someone else here have Facebook open? All right, let's try this. Hold on.
Yeah.
Okay, go ahead.
Okay, next is Stanley Hatchman, age 82. He was a professor of biology at the University of Rochester. Stephen Nedwetsky, age 68. He was a brick and stone mason and the co-owner of Edify Masonry Construction. Joyce Esther Nelson Hasenstab, age 88, and she retired from Eastman Kodak Company. Sorry, my page turned. Okay, I've got Lonnie Perlman, age 59. Robert John Paoni, age 91. Bertha Santaracco, age 89. She was an executive assistant with Bath Teak International and a staff member at the University of Rochester in the Political Science Department. Michael Saratora, age 65. Alvin Simmons, age 54. He was a U.S. Army veteran and an environmental service worker at Rochester General Hospital. Marie Tui, age 95. She was an office manager with Paul Revere Insurance Company. And that is my list.
Thank you very much, Harriet.
Uh,
Okay, we have an addition that a list of names that we added last night. These are all children of people who belong to a Facebook-based support group called Parents Who Have Lost a Child to COVID-19. It's a private Facebook group. And if we have some time, I might ask Lisa to talk a little bit about the group. But so all of the people whose names I'm going to list, that I'm going to say, they're not all children, they're not all underage, but they are all children of the people who belong to the support group. And the first one is Anna Bell Carter, who was 14 when she passed away from COVID, and she was from Fort Sill, Oklahoma. And her mom is actually the administrator of that Facebook group, and she wanted me to make sure that I shared that children can be affected by COVID-19 and that not being cautious can have a heartbreaking outcome. So that's what she wanted me to say. And the rest of the names, I'm going to read off. Some of the younger ones have ages, and I will read their ages, but I don't have further information about them. But Ian Ritzer, Robert Happ, Terrence Cooper, Joey Perez, Teresa Sperry, who was 10 when she passed away, Sarah Ann Shanahan, Trent Morgan, Victor Reyes, Benjamin Mann, Christian Umana, Lisa Jane Goldstraw, Brad Green, Matthew Newell, Quentin McCaskill, who was 18, Donovan Kittel, Lyle David Hobart, Freddie Garza, Brittany Lynn Bodzak, Jay Galdamez, Frank Miller, Jordan Kempkers, Jeremy King, Tiffany Silvley, Michael Allen Schrager, Ramon Peterson, Harley Kohlhoff, who was 9 when he passed away, Tanner and Derek Preston, Jordan Franklin, who was 11, Carson Robinson was a newborn when he passed away from COVID-19. Donovan Horn was 13. David Caballero, Jareem Martinez, Zach Leviton was 16 when he passed away. Jennifer Shiflett, Hannah Mansell, who was 22. Justin Reber, Anthony Velez, Bradford Green, Nick Hertz, Amanda Brame, Hasten Mathis, who was 18, Ricky Robertson, Alberto Valencia, Michaela Jones, who was 15, Randy Betts, Adam Russo, Aaliyah Outerbridge was 11 when she passed away from COVID-19, Chad Dorrill, who was 19, Johnny Probicki, LJ King, Brianna Legg, who was 22, Chris Pippins, Gabriella Blakely, Danny Cater, James and Joshua Andrus, Heather Buchanan, who was 18, Braden Wilson, who was 15, Rita Traylor, Eddie Hernandez, Stephen Heimer, Kyle Dixon, Sean Crawford, Chelsea Richardson, Alexandra Chandler, and Levi Keffler. And I just want to say, having read that list and knowing that all those people, that their parents are in this support group, still talking through their grief, is really important. And just reading that list, especially when I read off an age, and of course, especially when it was a very young age, it kind of brings home to me really how devastating COVID has been. And I assume that when there was two names together, like Joseph, well, Tanner and Derek Preston, I'm assuming they were siblings. And just as with the married couples, it's a tragedy that unfortunately we have seen many times as we've honored people on our wall of memories. And just reading those names this is why we do this, because it's such a simple thing, but when you read the names, you're telling people something about a human being who died of COVID. So I personally think it's a very powerful thing. We do have some extra time, so I was wondering, Mohammed, if you could talk a little bit about how many people are honored on our wall so far and what sort of our journey has been since we started this project in 2020. Was it spring or summer 2020, I think? So if you could just talk a little bit about the evolution of it and where we are right now. You're muted.
Well, the project started out of the when we were looking at the new. This is early 2020, January and February, and in the news you would hear all these numbers, number of cases, number of people dying, and and um, we realized that these behind these numbers are people. There are people in our own community, at our schools and our hospitals, that felt like we need to remember them. Um, and my vision was something similar to the Vietnam Memorial that I have visited a few times. And I wanted to have, you know, a little more than that, pictures of the victims and a little story about them, and have the ability for their loved ones to come and visit the memorial, virtual memorial, and leave messages on the wall and share it with their family and friends. And that's how it got started way back in April of 2020. And we had our official launch on 4th of January of 2021. And since then, thanks to a pool of really dedicated volunteers who have been who have been with us through this journey, have helped us honor. Right now, it's almost 12,000 people who have lost their lives to this terrible disease that are honored on the wall. And it's when I and I take care of that portion of this memorial project where I review every one of these inputs that come to the project, because I want to make sure everything is vetted and correct, and there's no mistakes, there's no errors before they are honored on the wall. And reading their stories, it's really, I mean, it really makes me sad. I mean, there are so many instances, especially since in in 2021 and now 2022, some of the folks that have passed away because of this virus, I feel like there was no need for them to do, to die, because the vaccines are available, there's treatment is available, there's precautions that are in place, and if folks, adhere to those things, then they reduce the chances of this hazard. So it just makes me sad, and this is way back in 2021, June of 2021, um, uh, when I first read this story about a family of 6 people right here south of where we live in Lamarck, Texas, which is a town south of Houston. Young couple, the husband is 49 years old, the wife is 42 years old, and they have 4 children. The oldest was 17, the youngest is like 6 or 7 years old. And they, for whatever reasons, they thought that they were strong enough that they did not need the vaccine. And unfortunately, they were at a camp, a summer camp through their church for a whole week. And when they came back, all of them were tested positive for the virus. And unfortunately, the husband and wife, they both passed away 2 weeks apart. They were their rooms, their beds in the hospital were just a few feet away from each other.
Yeah.
And this was such a sad story. And when I read this thing, and now the 4 children are orphans, and they are being taken care of by their families. Just, and there's literally hundreds and hundreds of cases like this. So many of them are honored on the wall, and
Mhm.
it just makes me really sad that this is something that this pandemic is causing havoc on so many families in our country. Thank you.
Yeah, thanks, Mohammed. You made a couple of points that, as far as vaccines go, I mean, first of all, for one thing, we for sure, we don't care if people were vaccinated or not, as far as whether or not we want to honor them on the wall. No matter what happened, they passed away. They deserve to be honored on our wall of memories. And I would also say, I think as time has gone on, we've sort of seen a progression. Like there was sort of like a 2020 COVID before vaccines, when people were just getting sick so easily and unfortunately passing away so easily. And now things have changed a little bit, but people are still unfortunately dying. People are still getting long COVID. So we're really not out of the woods yet. But I think that's one of the things that we have seen. And I just also wanted to say, when we started this, sort of the turning point, or the point when the spark was lit, was when we hit 100,000 people who had passed away. And if you remember, the New York Times had that front page that said 100,000 dead and incalculable, or it was, I don't remember the exact word, but it was like an unbelievable number. And then they had the entire front page covered with the names of those people. 100,000.
Now we're at a million.
100,000. And
Now we
to
are,
think that we would be
Million.
where we are now.
yeah.
So, yeah. So Harriet, I'm sorry, you wanted to say,
I was gonna, I preempted, and where are we now? A million names, yeah.
yeah. And I
Yeah.
mean, who here ever thought that that would happen? That we would end up with a million in less than 3 years, right? So it really is something that has shaken this country to its core, I think. And although people want to now feel freer, um, we still need to really be on our guard because we just don't know enough about it. So, and Harriet, we see you every week when we have a Zoom get together with all the family, and the pandemic is very often a subject of discussion. And I was just wondering, have those discussions sort of like shaped your perception or your just sort of like how you see the pandemic, how you live your life, all that sort of thing, you
Well,
know?
yeah, no, that's a good question. And I appreciate you bringing it up. It's been a support group because I have chronic underlying health conditions. No need to discuss, but so do millions of people. And there's just such a gap between how I have to view this and how many other people are viewing it. And it's very supportive to be able to touch base with like-minded people. And it's not to be critical of people that make other choices. And I just think that's so important, but it's just a challenging time to navigate and making the decisions. It was almost easier. Life was almost, this sounds silly maybe, but it was easier when we all had to lock down. It was just so clear. And then as things changed and loosened up, but did they, should I, shouldn't I?
Right.
And then just a lot of decisions around that. And then we've had a chance to compare in our different communities. Rochester and Finger Lake, Central New York, we had quite the recent surge before we were on the front end of a new wave. And it's now, of course, grown elsewhere, but I don't know. And I'm grateful for the medical resources in my community and the level of fairly transparent. You never know how transparent news is, but anyway,
Yeah.
yeah.
Yeah, I like you saying that it's a support group because being family, sometimes we're a little bit back and forth, like, how could you do that? Why are you doing that? But it's like you said, it's
That's
hard
okay.
to make
That's
choices,
okay.
you
Yeah, that's
know?
okay.
Yeah,
I mean, to be able to do that in a safe environment, it's like, well, you can't do that. And it's okay to say that, but with people that are not your comfort zone,
right.
I
Right.
keep my
Yeah,
opinion to myself.
right. And
Rhonda.
Lisa, I actually want to ask you about, the experience of being in the Facebook support.
Well, yeah, and I'm actually in a couple of the Facebook support groups. They have the Yellow Heart Memorial. They've got the COVID loss of support family and friends, and then the family of children's lost to COVID. And it is an amazing, especially the parents of children deceased of COVID-19, and it gets children all the way up from 30 to 40 to, in the teens. But we can talk to each other and relate to each other in ways, because our emotions are like roller coasters. One day we're just doing fine, keeping busy, and then we just, crash. And it's good to relate and talk to each other, that we know that we can talk without feeling bad or we don't have to get over this quick. It's not done, that this is a normal thing and that we all go through this. Amber Carter put this group together, and her daughter died, and it was just amazing. And we are a really good support group, best found, that because we have gone through this, and we know that we still have the emotions and, PTSD, suffer. And we were finding all these things out from each other that, that we realize they're normal, that we can share only because we're experiencing the same thing
Yeah.
together. And whether it's been like my son, he had passed, just weeks before the COVID vaccine came out.
Oh, wow.
He was diagnosed February 1st, and he fought a brutal, he was sent home from the hospital. He said, go home and quarantine. We stayed in a hotel, and then a ambulance had to come get him and put him in ICU. And he fought a brutal fight with COVID for another 5 more weeks before he passed away a week after his 24th birthday. And this was just weeks before the shots came out. And it's just, it's amazing. And you have a lot of people who've got the shots and immunizations, and a lot of them who haven't. And a lot of people who did get them because of my son's passing, they realized, because I know at the beginning, nobody knew of COVID. They thought it was maybe it could be, just scam or some, it's just things you would hear,
Right.
until it really started affecting people and they did know. And these support groups are really good and wonderful that they have on Facebook that help. And, you know, I- if you have a loved one that has passed, I would suggest that you reach out to one of these support groups because they have some really good ones on the Facebook for you to talk with somebody else and know that you're up at 2 in the morning. You're not the only person up at 2 in the morning, having the same things. It is good. It is to share with people who've lost.
One thing that I found in talking with people who have lost someone from COVID, tell me if you agree with this idea. I feel like it's sort of a different kind of grief. There's like a lot of anger in it. I found.
Well, I'm not saying that a grief, one parent's grief from losing a child or somebody they love is different.
Mhm.
It's the questions that we have and the emotions. It's almost like, I feel like my child's been murdered. That yes, it's not a murdered child. It's a child murdered from a disease that's worldwide. So we have these questions and these angers, and we what's happening and why, and um, the same questions, and that kind of relate. And I felt like with the support group is somebody who has the same kind of questions I have, same anger that I have. That my child's been taken from a worldwide epidemic at such a young age, who didn't have who was healthy. Um, is easier to talk to somebody who has going through the same thing, and we all have these same questions, and we all kind of get the angers, and um, because it is a worldwide epidemic, and because it is still out there, it has not gone away. It may not ever go away. We don't know the repercussions of the shots. It has kept us up, living longer. But it is a little easier to talk to somebody who we have these questions, and we're kind of the same kind of unfortunate, passing because of a worldwide epidemic.
Mhm. Yeah. Well, I'm glad to hear that you kind of validating the sense that I had, which is, like I said, it's just feels different when I talk to family members of people who have passed away from COVID.
Right.
So, and Mohammed, you had mentioned the volunteers that we have who put so many of the um, stories of the people who've passed away on our wall. And I just wanted to kind of go over the three different ways primarily that we have names on the wall. So I can talk about that. I don't know if you want to talk about that, or we can both talk about it. But well, you're muted, so I'm not sure if you're giving me the go ahead.
No, you can talk about it, but
Okay.
I just wanted to find out from Lisa. Uh, Lisa, which Cabela's did Alex work at? The one in Pasadena or League
Yeah.
City?
Well, no, there's actually one, there's only one in Lake City. There's only one Cabela's here in the Houston area, which is in Lake City. And it was about at by Bass Pro Shop. So they're kind of both same, but it was the one in Lake City. He worked at the one after he passed away from high school, went up to Washington, and he was staying with his aunt, and he had worked at the Cabela's up there.
Oh,
And ironically, I was looking for a part-time job, and I took the job down here at the Cabela's just to be kind of closer to him, to know what it was like with his working there. We both like camping and so on. And then when he moved back down here, he came to this job, the Cabela's where I was working at, and then I went on to get, a full-time job working somewhere else. And the Cabela's down here in Lake City, yeah, and they're a wonderful group. They were very supportive. They even, when he had passed, they had actually brought in people from across the other cities in Texas to work on the day of his funeral, so the people from Cabela's could actually attend his funeral. They're awesome. They're like a family to work for. They were very great, very good.
Wow. That's good. Yeah, it's really, really important to have that kind of support and facilitation so that you don't have to worry about anything except trying to get through what you're trying to
Right.
get through.
And they did. They were a great help, and they still are to this day.
That's
Hmm.
great.
Yeah, I may have, I don't know, was he working there in 2018? Because
Yes.
2018,
Um,
I was looking for hiking boots, and I may have wandered into Cabela's in League City hunting for
Oh,
hiking
isn't
boots.
that something?
yeah, actually, I think he came down to this Cabela's was 2019, I believe is when he came down here to this one in
Oh,
2019, and he was in the hunting department.
Mhm.
oh, okay.
Yeah.
Wow.
But who knows? Maybe you ran into him. Who
You
knows?
might have
Yeah.
ran at that time. You might have ran into me. I was an operator there.
Oh, there you go.
Yeah.
It's a family
Well,
affair.
it's a small world.
Yeah,
Right.
exactly. So, the way that we have gotten to nearly 12,000 people honored on our Wall of Memories, basically there's three ways that these people are on come to be honored on the wall. One is, of course, that people like Lisa put their loved one's story on the wall, just submit it, and as Muhammad said, he vets the what people anything that goes on the website, we check it out just because it's the internet. And people do
Right.
silly things on the internet. So that's one way. And the second way is we go to online obituaries and looking for people who've passed away from COVID. And what we do is we take like just a little excerpt from the obituary and put that in there so that there are some details about the person's life, but we're not taking the entire obituary because very often those are kind of personal, people have written them themselves, and we don't want to just kind of go and say, well, we're going to use this, we're going to put it on our website. We don't do that. But that's where a lot of the people who are on the wall came from. We occasionally also use news stories, but that also we use just a very short excerpt. So we have just a few people who are honored that way. But we would love to have more people entering onto the Wall of Memories or onto the website their own loved ones because those people telling the story really makes it more authentic and personal. And in the noon hour, we're one of our people who's going to read names. Her grandmother passed away and is honored on the wall. And there were so many comments that came in from family members that I almost felt like I knew her because they talked about a lot of her habits and that sort of thing. So having that really personal touch is something that's so important. I mean, it really amplifies what we're doing and really it gives it sort of a greater quality, if that's the right word. So Mohammed, do you agree with that? Especially since you handle the data side of it. That's all you.
Yeah. Yeah. I agree.
Yeah. So, and when I say, go ahead. Oh, were you going to say something? Okay. And when I say that he handles the data side, just to point out that we also have either a news page or a blog. We're actually undergoing some revisions right now to the website because the second part of our mission, in addition to memorializing people who have passed away, is to inform and educate. So that's the side that I kind of take care of. I take care of content. He takes care of data primarily. But we're really, our tagline is telling the story of COVID-19 in America. And that's what we're really trying to do, is sort of point out the different things that have happened along the way. We have when the new blog is up and in place and functional and free of bugs. There is going to be one of the first articles on there is about grief. And, as I said to Lisa, there is sort of
Hmm.
this kind of COVID grief that's different.
It
And
is, yes,
mhm.
yeah, it's, man, it's pretty bad. And like I suffer from PTSD from just the ongoing of, watching my son suffer. And
Yeah.
the grief is, tremendous, especially losing a child. You never plan on, burying your child before yourself, or going. And there's griefs as your children who've lost their parents, and it's just as immense, and the good thing about these groups, they are private because they're not, unless you've lost a loved one or, with somebody to COVID, nobody's allowed to get in there and pipe in. So you don't have to worry about people coming in and reading your thoughts or how you're sharing things. These are all going to be people who have lost and are grieving. So it is definitely something to support. I would suggest if somebody is looking out to talk to somebody who's lost somebody from COVID, reach out to one of these groups because they're very, very good, very powerful.
And I just wanted to, because she came to us, I just want to again tout Amber's group on Facebook, which is Parents Who Have Lost a Child to COVID-19. That's the name of the group. So I guess if you search for that, you'll find it. It is a private group, and we were able to get this list of names, but there's over 400 people in the group, right?
There's a lot. Yeah, this is
Yeah.
tremendous. I remember when I started out, I was like 90, and it's just, gone. I couldn't even tell you how many now, but it's pretty big. And again, they've got the support groups, COVID-19 law support for families. So they have one, for just, families. So you see a lot of people. So it's not the children, it's your brother, your sister, your mother, your grandmother. They have another one on there also that's really good. They've got some really good ones on there.
Yeah, that's great. Yeah, does anyone have any other comments or thoughts?
This is just something I've been thinking about it. And then there was an article in the New York Times, which I didn't even want to read, but it mirrored my thoughts, is what the disparity, the big gap between people that are grieving. It's not going away. The way so many people are saying the pandemic is going away and they're out and about and life is normal, and then some of them get sick, but then it's just such a disparity. It's like two different worlds.
Lisa,
Yes.
what do you think about that?
That's gotta
Well,
be.
yeah, absolutely. And it's the same thing with the grieving, because people want to say, all right, now they've gone, when are you gonna get over it? And you don't get over it.
Right.
Yeah, it's not when
No.
you don't, it's something it's never, and so you kind of almost feel guilty about sharing or talking to other people about it. And that's why these groups are good, because you realize you could share this with them and talk to them, and it's an ongoing process. It's just
Right.
something you have to live with. It's learning to live without that person in your life, which is so hard to do. And that's why these groups are very, very good. And not only on Facebook, they had them, up to the public for people that don't get on Facebook, that might not have a computer. They need to, be able to have
Right.
access to
Right.
things like that. You need to open things like that up to people in their area, which seems to be hard to do. It's almost like people don't want to talk about it, or it's kind of gone away, as you're saying, and they want to just move on, thinking
Move
that
on. Yeah, let's just move on. Yeah.
yes, it's
Yeah.
like kind of a things, get on with life, but it's kind of hard to do when you've lost somebody they haven't, it's very,
Yeah.
grief is just, tremendous. It's something I carry every day. Like I say, it's an emotional roller coaster up and down, and I'll be doing great if I stay busy. It's great. I don't have to think. But then at the end of the day, it just, it hits you. So, and that's a normal thing for people who are going through losing somebody of COVID.
Yeah.
And then you have a lot of people who've caught COVID that have repercussions, and you've got that group. They're
Right,
trying to be survivors of the COVID, and they're survivors of COVID. That's another support group for people who are trying to survive the things that when they almost died from COVID, but didn't, but now they're facing a lot of other different obstacles. It's not going away anytime, probably in the next, I would say, 50 years. This is an ongoing thing, and we don't, again, know what's going to happen, repercussions. You know, you wonder if we're going to be around in 5 years, what's going to happen. So,
Yeah, I think for me the uncertainty right from the beginning was kind of what was driving me crazy. I was up in Northwest Arkansas doing a writing workshop in the middle of March. So I drove back down to Houston. I think it was like March 15th or 16th. So it was like right when I think that was shortly after the WHO had declared it a pandemic. But there still was so much that we didn't know
right.
about it. And I remember I stopped in a Buc-ee's, and for anyone who's doesn't is not from around here and doesn't know what a Buc-ee's is, it's a humongous travel center that where you can buy like almost anything that you might need if you're
Truck
on the
stop.
road
Yeah.
or even if you're not on the road. And there weren't even like bottles of hand sanitizer at the cash registers. And I was just looking around thinking, well, here I am reading the news and it's so dire, but look at where I am, you know. But then I went to buy I think it was a soda, and as I walked up to the cash register, the cashier started coughing, and I was like, okay, I'm out of here because the one thing that I do know is it's a respiratory disease. But that was just sort of like a snap decision at the last minute. So I think
Well,
still to this day, it's the uncertainty that bothers me the most.
well, this is an uncertainty. Like I said, February 1st, when Alec had, they said, you know, you got COVID, go home. And we're, you know, we went to a hotel because my, we're going to get relatives sick. We didn't even know what to do. Right? What do we do now? We just stay here and we just try to get over this. It's supposed to be like a flu-like symptoms. I mean, we had no idea what to do. Really, he had COVID and nobody knew what to do. Just quarantine is all we were told. And, you know, what do you do? What is it about? What does it affect? And until he goes into the hospital. And it was ongoing, even in the hospital. You know, oh, we're going to go over this. You're going to be out. You're in the best place. Still did not know, you know, and until somebody passes, it's just every people, they're young, they're not supposed to pass. Well, yeah,
Right.
you know, it's like
Yeah.
they're not, but who says who? And it's like the best way I can describe it is like playing blackjack, you know, throwing dice, you know, you're
Yeah.
lucky if you don't get it, you know,
The gamble.
it's a total gamble. One
Yep.
person can have it, be a carrier, not even know it, and then the next person, you know, kills them. You know, they have it and they die. You don't know why. You know, some people are like, well, is it in their blood? What was your blood type? Oh, they must have had an underlying health condition. He didn't have one, you know. But I did find that a lot of people, I think it was type blood A. You know, we find out a lot of people find out maybe it's something with the blood. We still don't know why some healthy people die and get it, and some can just be carriers. It's still a question, and until we know,
Yeah.
we continue, especially when you have people who are unfortunately are unvaccinated.
Yeah. And I'm feel so strongly about the mask because that at least because it's a respiratory disease,
Mhm.
that's like the most obvious thing that we can do,
Right,
you know,
right,
so that for those, even though cases have gone down, deaths and hospitalizations have gone down, although here in the county we live in, Harris County, cases have gone way up, like over 100% over the last couple of weeks. But they
Same.
haven't changed the alert level because deaths and hospitalizations have not gone up. So,
right.
you know, so I'm like, well,
You never know. You just can't trust it. And so, yeah, stay inside, keep your mask up, have your shots.
yeah,
It's the best thing you can do.
yeah, yeah,
Wash your hands.
Yeah.
Yeah, try to stay away from unvaccinated people. I'm not saying it's just, you don't know if they could be carriers and it doesn't affect them. And they don't know that
And they
either.
don't know. You don't know, and
Yeah,
they don't know.
and
Right.
they don't know exactly. So,
Yeah.
you know, it's your life you're talking about, and it's somebody else's life you're talking about.
yeah. Yeah, sometimes I feel like the lesson of COVID is that we need to take care of each other, you know, that we need to be concerned with each
Absolutely.
other. So, well, we only have 10 minutes left in this session, so, you know, we could wrap up the discussion. I was actually thinking about maybe because I know some of the parents that who are from the support group and whose children's names I read at the beginning. Um, I know that they were going to come during the 11 o'clock hour, so I might just read that list again. And if you guys can bear with me, and then we do have another hour coming up with some new readers. So I'm just going to go ahead. And of course, the first one was Annabelle Carter, who was 14 when she passed away. And her mom is the administrator and I guess founder of that
Yeah, yeah,
Facebook support.
yeah. Her name is Amber.
Right. Ian Ritzer, Robert Happ, Terrence Cooper, Joey Perez, Teresa Sperry, who was 10 when she passed away, Sarah Ann Shanahan, Trent Morgan, Victor Reyes, Benjamin Mann, Christian Umana, Lisa Jane Goldstraw, Brad Green, Matthew Newell, Quentin McCaskill, who was 18 when he passed away, Donovan Cattell, Lyle David Hobart, Freddie Garza, Brittany Lynn Bodzak, Jay Galdamez, Frank Miller, Jordan Kempkers, Jeremy King, Tiffany Silvley, Michael Allen Schrauger, Ramon Peterson, Harley Kohlhoff, who was 9 when she passed away, Tanner and Derek Preston, who again I'm assuming were probably siblings, which is, that family transmission is an unfortunate fact that we've seen, excuse me, with COVID. Jordan Franklin was 11. Carson Robinson was a newborn when he passed away from COVID. Donovan Horn was 13. David Caballero, Jareem Martinez, Zach Leviton was 16. Jennifer Shiflett, Hannah Mansell, who was 22. Justin Reber, Anthony Velez, Bradford Green, Nick Hertz, Amanda, I lost my place, I'm sorry. Amanda Brame, Hasten Mathis, who was 18, Ricky Robertson, Alberto Valencia, Michaela Jones, who was 15, Randy Betts, Adam Russo, Aaliyah Outerbridge, who was 11, Chad Durrill, who was 19, Johnny Probicki, LJ King, Brianna Legg, who was 22, Chris Pippins, Gabriella Blakely, Danny Cater, James and Joshua Andrus, Heather Buchanan, who was 18, Brayden Wilson, who was 15, Rita Trailer, Eddie Hernandez, Stephen Heimer, Kyle Dixon, Sean Crawford, Chelsea Richardson, Alexandra Chandler, and Levi Keffler. I want to thank all of you guys for being here for this hour and reading names and, kind of discussing very frankly some of, unfortunate facts about COVID and how we feel about some of them. Yes, Mohammed.
Sam just called me and said he
Oh,
cannot find his list.
okay. I will email him. I emailed it this morning and I will email it to him again. He's actually reading last in the next hour, so thank you. So I will definitely take care of that. I've gotten the messages. So, this is the third time we've done this, and there were some, I think in the first, there was a lot of panic at one point because people couldn't find their list of names. So I'm ready for anyone who has lost their list. We will take care of that. So any final thoughts before we wrap up this hour?
It's been nice sharing this time with you and nice to
Yes,
meet
you-
you, Lisa, and hearing your story.
Yes,
Yeah.
you.
Yeah, Mohammed,
We
any
don't,
final?
we don't need to go away, right? We can stay on.
We can absolutely stay on.
Yeah,
Well, I
I'm
said,
staying on. Yeah,
yeah.
I'll be here
Well,
till
Lisa's here
10
for, thank you,
o'clock.
Lisa, for signing up for every hour that today. So yes, Lisa is definitely, but yeah, you guys can stay on and I will take care of sending Sam his list again. So
And
that
I'm
there's,
gonna say farewell,
okay,
but I'll check in with Facebook Live. I'll see
okay.
how that looks.
All
Okay.
right. Yeah, text me if
Yeah,
there's any problem with volume or whatever. And thank you
Okay.
again,
Yeah,
Harriet.
yeah, you're very welcome. You all take care. Okay.
Thank you.
Bye-bye.
Bye-bye. So, all right. Yeah, I saw the messages that you were sending me, so um, I will take care of that. And if you guys have anything that you want to talk about, feel free to go ahead and do that. Um, sorry, I can't send emails and talk apparently at the same time.
Yeah, not a
I mean,
problem.
is there a single email with one long list for everybody? Because I can forward it to him either
I'm
also.
forwarding him the list right now. Okay.
Yeah.
So, in fact, yeah, I still have it highlighted from when I sent it to him earlier this morning. So I'm gonna send it right now. And all right, there we go. And I'm sending it.
So Lisa, do you live in Pasadena or?
Uh, well, no, I live in Lake City. My mother lives in Pasadena.
Oh,
My son had lived with my mother when he moved down back from the Washington area, but I stay with my mother, right? I watch her and my autistic brother. So
oh,
I'm kind of back and forth right now from Pasadena to Lake City, my
oh,
house,
wow.
their house.
Yeah,
But yeah, I'm down here with you guys, down here in the Houston area.
we live in Clear Lake, right, almost right next to League City. Yeah.
Mhm.
Yes.
Yeah, yeah. And we have people from across the country honored on the Wall of Memories, which is really interesting. But a lot of the people who have submitted their loved ones' stories are from this area. So for whatever reason, I find that interesting. But like I said earlier, we would love to have more people sharing the stories of their own loved ones because when we take the excerpts from the obituary, it's just not the same. You know,
Right.
it's just not the same. And sometimes family members will go on to the record of that, that has to do with that person, and they'll leave messages. And it's like I said, next in the next hour, Sylvia, her grandma, somebody wrote a poem that they had written. Other people left messages that like just had a lot of details about kind of the funny or quirky things that she did. And I think that's also a really good opportunity for people to take advantage of the wall of memories. And that's something that we really are trying to accomplish with this, is to sort of open the door to people understanding what COVID is all about, how it's impacted us. And Lisa, for you to be here sort of, witnessing to that is really important for us. So,
And
so thank
yeah, and
you.
it was important to me also to make sure that uh, they realize there's so many young people that who have passed from this, that, it's not just an elderly and somebody who has, might be ill, have lying under conditions, excuse me. Um, but yeah, it affects so many people that are out there, and it's just like I couldn't believe that they like I would still get responses. People are like, well, he's so young, they're not supposed to die. And I'm like, says who? Says who, and there are a lot. And there's a lot of people, it's trying to reach out into the public with their grief might be just as hard. And I think it's why they go to some place where they feel safe to do. I know it was very hard for me to talk but about my son in COVID. I had signed up for groups before, but then I just ended up having a meltdown, basically, you could say, before it happened, just because the part of the grief. And so, stronger you get in bonding, and the more it's out there and the more support you get, I think people will be coming out more to do it publicly. It's almost like if you've got your child or your parent or somebody's died of COVID, it's almost you like not want to be said. I At first it was almost like, should be quiet. They have COVID and just leave it alone. We're trying to get over this kind of thing. And it doesn't go away, and it will not go away. It's still out there, as much as people want to believe.
Yeah.
I've had friends that were never going to get the shot, but that have got the shots and they've got their boosters and then have recently got COVID. even with their boosters and
Yeah.
everything else.
I
And
see
they're
that a
still,
lot.
but, and I'm like, I'm talking to somebody just last week a friend of mine who had got COVID, and they've had their boosters and everything. And thank goodness they had their shots, because they could be sicker, or they could be in the hospital, or they could be passed. But because they had all the shots and so on, I think that's important to know. But there are still a lot of people who disagree and just don't want to talk about it. So it's very it can be very frustrating. Yeah, it can be very frustrating, because you still got a lot of people out there who don't believe in it, but then you still have a lot of people do. So it's almost like you have to fight for your rights and fight for your life, basically, is what it is when it's what you're
Yeah.
doing, and fight for the lives of others with COVID.
Yeah.
So hopefully with more of this, we can get more people and get their names out there, get more.
Okay, we keep losing Sylvia, and I hope that uh, she's not gonna, maybe she has a bad connection, but we'll find out in a minute. And you can tell Sam I sent it to, there's an email that has investment in the domain, if you want to tell Sam that.
I did.
Okay, that I sent it to that address. So Sylvia's still connecting to audio. Yeah, I think she may be having some technical difficulties. So, which for our as much time as we've spent on Zoom over the last, what, couple of years, 2, 3 years, we still have those technical glitches are still with us. So, but we've kind of adapted to this new world.
Yes,
So,
I was introduced, yeah, Zoom was kind of introduced with me because of COVID. We couldn't get
yeah,
out.
yeah.
Yes, and
Um,
so,
Mohammed, also, if you're exchanging messages with Sam, you can let him know that he can just come on now because he's scheduled for this hour
I
and
told him to
he's
come
scheduled
on.
to speak last.
Yeah, I told him to come on when he called me 30 minutes back.
Okay.
That he wants to read the list and be prepared.
Okay, well, he's speaking last, so it shouldn't be a problem. He'll have plenty of time to go over his list.
Yeah.
So,
would you like me to begin on mine?
I just want to, if just, I want to make sure that Sylvia is getting connected because she's still connecting to audio. And I
Okay.
want to make sure that she's not having, I don't know, technical difficulties. Um, so let's just give it one more minute and hopefully Sam will also come on. Does he have the Zoom link? Here he is. All right. So now we have everyone, as long as everyone is connecting. Everyone is still connecting to audio. So as soon as everyone is connected, we can get started. Hi, Sam. Hi.
Good morning.
And Sylvia
Morning.
is online now, I think. Sylvia, you keep bouncing out, but can you hear us? Okay, I think what we'll do, just in case Sylvia, oh, there you are. Okay. You had some difficulties there for a moment. So everybody, I'll just introduce, we've got Lisa, Sam, and Sylvia here, and they're going to be our readers for this hour. And the first person who will be reading is Lisa. So Lisa, if you don't mind, just go right ahead and let's read some names and think about the people behind the names.
Okay, here we go. Ruth Aguilar, age 68, from Fort Worth, Texas. Shirley Bannister, 57 years old, from Columbia, South Carolina. Demetria Bannister, 27, Columbia, South Carolina. Dennis Allen Bratt, 29 years of age, from Colonial, New York. I think I'm saying that right. Patrick Robert Dragon, age 50 years old, from Brooklyn, Connecticut. Billy Wayne Driggers, age 72, St. Paul's, North Carolina. Annalise Earwood, age 54, from Nashville, Tennessee. Adeline Marie Fagan, 28 years old, Lafayette, New York. Philip Eugene Hill, Jr., age 62, from Toledo, Ohio. Deborah A. Walker, age 50 years old, from Lima, Ohio. Daniel Joseph Wilson, Jr., age 58, from Kissimmee, Florida. And Simon hope I say this right, Zamudio, age 34, from Carpentersville, Illinois.
All right, thank you very much. And Sylvia, if you
Yes.
can take as much time as you want to talk about your grandmother if you'd like. So, because we may be wrapping up a little bit early. So, and then you can read I don't know if you were going to talk about her first and then read the list of names.
I'll do the list first and then put her at the end.
All right, very good. Please go ahead.
We have Paula Acala, 63, from Worcester, Massachusetts. Paul Lindoff, 48, from Salt Lake City, Utah. He was attorney and founder of Lindoff. Don Nichols, 59, from East Wenatchee, Washington. She was a CNA. Eric Pagan, 38, from Sharon, Pennsylvania. He was a chef for 20 years. Ramesh Patel, 78, from Wallington, New Jersey, forensic chemist for NYPD. And then we have Barbara Wentworth, 72, from South Carolina. She was the owner of Camerlin Superette, I guess it is. And then we have my grandma, which is Naomi. She was 76. She was a loving grandmother. She was top of the family, kept everybody together. All get-togethers around her house. Everything was there.
She was from
It's just
Houston.
hard. Yeah, from Houston.
She's from where we're at. Yeah.
But she was the rock of our family that kept everybody together. She had 6 kids and a whole bunch of grandkids and then great grandkids. But
Mhm.
with pandemic coming in, just took her away. It wasn't fair,
Yes. Yeah.
but it's still hard. We just take it day by day, but just keep going. But we just cherish all her memories that we had and keep her name going to life.
Which is something I hope we're doing by having her name on the wall of memories, is
Yeah.
to kind of keep that memory alive. And I'm trying to remember, there were some details that I think some of the people who left messages talked about, that she used to like to drink soda and watch her telenovelas, or is that someone else that I'm thinking of?
No, she would watch her novellas. It would come on, I think, what is it, 6 o'clock one, and she's like, okay, I gotta go. My novellas are coming on. Don't bother me. And she would go, and she would like to sit outside in the backyard. She had this white metal, like a rocking chair. She would go out there and sit in, backyard, just sit on her chair
Yeah,
and be outside, enjoy the nature out there. That's what she liked to do.
yeah, because I know that in the messages that people left, the condolence messages, they mention that a lot. So,
Yeah.
yeah. So, and that she used to drink Dr. Pepper, is that right?
No, she liked Coca-Cola.
Okay, all right. I must
She
be.
would always say, bring me a Coke, and her
So,
brownies.
yeah, and candy bars?
She likes
Or
sneakers.
Snickers, I do
Yeah,
remember that. Yeah.
yeah,
So, yeah, it was a very interesting story reading about her, and we kind of refer to her a lot, when we talk about families leaving messages and that sort of thing. So, yeah.
yeah. She was one of a kind, and we just cherish all the memories now that we have, that we had, getting with her, all the good times, the Thanksgiving, Christmas, and all that, just cherish everything we have now.
Mhm. Yeah. And Lisa, has been chiming in because she also lost someone to COVID, so she knows,
Yeah, I
how.
was hearing her story on the other one, which,
Oh, okay.
Yeah.
yeah, it's just one of those. It's just different from anything else.
What part of Houston does she live in?
We lived in Spring Branch, so kind of like the west side area, close to Memorial.
Okay.
Yeah,
Curious. I mean, it seems like I haven't met a lot of people in the Houston area. And as much as we've lost so many people, I just haven't, met a lot of people in the Houston area.
yeah, she's lived
So,
here her whole life. Uh, she was born in Beeville, Texas, and then ended up in Houston. So, but ever since then, she's been here, raised all her kids
Right.
by herself. So she was, that's how she was. She showed everybody how to keep everybody together. And, if she did it by herself, she showed, anybody can do it.
That is backbone of the family. Yes.
Yeah.
Sounds like
Well,
you.
thank you, yeah, for sharing about her. And we can talk a little bit more. But I'd like Sam to be. Now, Sam, are you also going to talk about a relative or relatives that you lost as well?
Yes, yes.
Okay,
Good
as well as
afternoon,
reading the
Ruth. Yeah,
names. So please go ahead.
sure. I'll talk a little bit about my auntie-in-laws after I read my names.
Okay.
I'll start with Terry L. Adams, 74, Dillsburg, Pennsylvania. Macario Baez, 77, Corpus Christi, Texas. Barb Dahl, 85, Montgomery, Alabama. William L. Doyle, Jr., 75, Norfolk, Virginia. Jessica H. Esther, 41, Cassopolis, Michigan. Augusto Flores, 74, Houston, Texas. Jeffrey T. Mack, 62, Barnegat, New Jersey. Kenneth T. Moore, 52, Fort Washington, Maryland. Patty Sekal, 62, Honolulu, Hawaii. And Jeffrey K. Ewan, 73, Las Vegas, Nevada. My two aunties, actually my wife's aunties, and we're all family, Verdi Lee McClendon and Ruthie Mae Davis. They were both educators and community activists, and they hailed from the community called Lott, Texas, near Waco, Texas. And, close-knit family, the small town there is interesting. Lott, Texas, everyone basically was family. And when we went to Aunt Ruthie's, I'll tell you how small the town is. Aunt Ruthie's funeral, we went, and I was teasing my wife because I saw a young man about her age, and I said, "Hey, it's probably your childhood, boyfriend in elementary school." And my wife laughed and said, "No way. Everyone in this town are related, so we would have to actually go to another city in order to meet someone." And so, that just showed you the significance. My wife wouldn't be where she is today without both of those aunties and, just raising her and giving her those values of family and love and community and faith. And so, they were definitely taken too soon. This pandemic, like the young lady just mentioned, has made us, I think, cherish every moment together as family members even greater, because tomorrow isn't guaranteed. And so we honor all those who have passed on, and we promised in their memories to live a full life and be as proactive to keep others safe as possible by encouraging safety, encouraging those of us that are healthy or know the information to share it so we can keep our family members safe. So thank you for allowing me to share, and thank you.
Thank you, Sam, so much. And we have a little time to chat amongst each other. So I wanted to point out that Sam is also a member of the board of COVID-19 Wall of Memories, which is a 501c3 nonprofit organization. And Sam, I'm going to put you on the spot. I'm going to ask you why, when we invited you to become a member of the board, what was it that motivated you to say yes? Besides that, I'm such an awesome person to work with. I'm kidding.
You took the words right out of my mouth, Ruth. You and Muhammad both. As a retired military member of here in the United States, I've been, my whole life has been about serving others. And COVID-19 Wall of Memories epitomized that type of commitment. And so it was a no-brainer for us, myself, because everything we do, when you have me, you have my wife too. So you have two for one.
Mhm.
And so, and something like this, honoring fellow Americans, getting the word out, keeping their memories alive, letting their loved ones who remain know that their family member is not forgotten. Uh, it was a no-brainer. And if anything, my hope moving forward is to do more uh, with all my being, because it's so important. Honor is so important. Love is so important. Honoring their memory is so important. And so if I can just, be a catalyst for positive change, a catalyst for positivity, for light, for love, I'm all for it. So that's why, you have me, Ruth. You have my total commitment. And it's just an honor to serve others.
I appreciate it. And you actually were also instrumental in some of the offline, if you can call it that, activities we did. Like we had a vaccination drive,
Yeah.
we brought the ICU nurses some goodies during the last winter surge.
Yeah.
Um, yeah, so thank you for doing that, because that's also something that we want to do is be involved in the community. So, which is one of the reasons that we wanted to recruit Sam to be on our board, because he's, very community minded.
Yeah.
So, so thank
Yes.
you for
You're
your work.
welcome, Ruth.
Yeah,
Thank you for having me.
it's a pleasure. Sylvia, if I can ask you, during the last hour, we were talking a little bit about grief, sadness, having to do, is it different when it's someone who's passed away from COVID? That I kind of find when I talk to people in your position and Lisa's position, I feel like there's more sort of anger or frustration. Do you think that's true? And do you feel that?
It is, because I just feel like their lives were stolen from us because it wasn't their time to go yet. I mean, maybe everybody still had full lives to live and, much longer. And with this coming through, nobody knew. It's just, I think that just took their lives and stole their lives from them. And we do have anger, but it's like, what can we do? But it's a different kind of grief that you deal with.
Mhm. Yeah, it seems different.
And I just believe it's not fair. So, I mean, it's just taking precautions, think about others, think about yourself, and just take it day by day, because you never know tomorrow. You just never know.
Right, absolutely.
Yeah, and I like that, urging people to take precautions. I think that's really important. Sam, who did you have with you a minute
Hi,
ago?
I have my daughter Maggie. Come on, Miss
Huh.
Ruth. Hi, y'all. Uh,
Hi.
she's a
Now,
recent, yeah.
Maggie is also serving in the military, or is that another daughter?
Now, this is Maggie. Your contract just ended, right?
Yes, I finished my contract.
Well,
So
thank you both for your service. Yeah.
Absolutely.
Thank you for the support.
All right. Well, I guess she's a little shy,
Oh,
so
she's a little shy. I'm
okay,
constantly
that's fine.
volunteering her, Ruth, to do
Okay.
things. I won't be able to stay on much longer, but
Okay, that's
I'm
fine.
here for us as a group, individually. Ruth, you know, anything you and Mohammed have going, you have our full support.
Thank you.
And my prayer and my hope is that we continue this memory and COVID-19 wall of memories growing and being an impact in communities for years to come.
Let's
Yes.
hope so. Yeah,
Thank you, Sam.
You're welcome, y'all.
thanks
Bye-bye.
very much. Bye. And he's right. His wife is I think he described her as a powerhouse, and she absolutely is. So, and she's involved. I think she ran for office. I want to say Congress, I'm not sure, but she's just a really strong woman. So, and unfortunately, her aunt is honored on our wall of memories. Sam talked about the two aunts, and she was one of them. And I remember her story. She was an educator, like Sam mentioned, but she had just done so many sort of like breaking boundaries and starting new techniques for education. And she lived sort of out in the country in Texas somewhere. And it was just really impressive. And that's one of the things that I like about the wall of memories, and I feel gratified is that I get to like learn these stories that I might not otherwise have learned. So I don't know, do you guys ever look at the wall, like just go and because it scrolls, so every 15 seconds it scrolls and there's a new set of pictures.
I haven't seen it since probably last week. I know that we've added a lot of names have been added since then, so I
Yeah.
need to look at it again.
Yeah, I go in there and just see like, just scroll through it, see what new ones, are coming in or how much you guys have grown. And
Yeah.
I mean,
Yeah, because it started out, I remember when y'all first started, y'all were on the Great Day of Houston and everything, and my son's name got on there, and that was back in, last year. Yeah, and it's just tremendously grown. Um, and I'm so thankful for this, to having this here in Houston, because Houston's so big, and you would think there would be a lot more names. I'm
We would love,
surprised.
like I said, that's really, if you kind of asked us what we would most like to see happen with COVID-19 Wall of Memories and what would be most beneficial, I think that would be it for people who've lost a loved one to COVID. Share your story, share the story of that person that you loved and lost, because again, our tagline is telling the story of COVID-19 in America, and that's how we want to do it because this is something new. I mean, the Spanish flu epidemic was 100 plus years ago. This
Right.
is something that no one alive really has been through before. And so we want to document that. And I don't remember if I've mentioned this to you guys, but the Library of Congress actually selected the COVID-19 Wall of Memories to be part of their permanent coronavirus archives, which means that they, take like snapshots basically of different pages every so often, and they're all getting compiled in the Library of Congress, that particular archive. So a lot of the content that's on the website will be there forever. So, I would love to have more people. It's like it's a real way to honor people and to keep people's stories
Yes,
alive.
yes, and if all, nominations, ages, races, it's
Yeah,
just incredible. Yeah.
yeah, yeah, absolutely. Sylvia, were you gonna say something? I felt like I was talking you.
oh no, I was just saying, I mean, that's great. Just keeping everybody's name alive. We're not forgetting anybody. A lot of people will probably think, oh, well, this happened. We won't, remember them, but this will keep, everybody's name alive, regardless from here, far away, different states or anywhere. I mean, you can always go log, look it up and you just find random people. I mean, just their name is there, keep going and keep their memory alive.
I'm glad you're doing that because that was one of the things that we thought about when we were developing and creating the website was the idea that like with, my husband mentioned the Vietnam Memorial as being an inspiration because you can walk along that wall and see so many names of people who passed away in that war. And so we wanted this to kind of be, a digital version of the same thing that you can just go there and look at people's names. And so, and one of the improvements that we're having made right now to the website is to make that whole experience of watching, people as it scrolls by, to make that a little bit easier and smoother. So, and I have actually also heard from some people that they will go to people who have entered their loved one's story on the wall of memories, that they go every so often, almost as though they were going to, the graveyard, like to just go and remember that person, which, makes me, it's like if people are doing that, then then we're doing what we meant to do, and even maybe going beyond what we ever intended to do. So,
Yeah.
but, yeah, and Sylvia, I don't want to put you on the spot, but we were talking earlier about some of these support groups, especially like the online support groups. Do you know anything about those? I mean, have you been involved with those groups at
No,
all?
I don't have Facebook, so it's
Oh,
like
okay.
it's just reading when I follow the link on yours through Instagram, or that's how I find it, or whenever you email me, hey, we're gonna have this going on, that's
Yeah,
when I reply to you, or I'll join it or anything like that. But Facebook, no, I don't have it. I just have the
yeah.
Instagram one. So
Oh,
that's how
okay.
I keep up with you through, is that one.
Through Instagram. Okay, that's
Yeah,
good. Yeah, yeah. So, it takes me a long time to do all that social media stuff, but
I
hopefully
bet.
I'm doing it. Hopefully I'm doing it successfully. But yeah, so, and I'm glad both of you were able to use your virtual backgrounds. So, because it's nice to have, that picture of the person. And those are the photos that are on the
Yes,
website. So, yeah, I love them both. I mean, and I have
thank
to
you.
say that both my husband and I feel like almost like we know people who are, honored on the wall. Some we do know or we know their relatives, but most of them, I mean, it's almost 12,000 people we don't know, but we feel like we know their stories, we know the details of how things happened with them, and it's just it's really an amazing experience to do this. Not always easy, you know, when you see some of the names listed and the ages of people and, all the husbands and wives who died within days of each other. I mean, remember 2020? How horrible it was before there was vaccines, when there was just so much mortality, and it was so different from how it is now. But and Sylvia,
Waiting in line, yeah, waiting in line for toilet paper, I don't know if you remember that, for
yeah,
hours. Yeah, you remember that? Just who
yeah,
ever thought we'd ever, be standing hours fighting over toilet paper and different foods and stuff. Yeah.
yeah, exactly, exactly. That was a really dark time. I mean, and it still is a dark time in a lot of ways, but that was just like super intense.
Well, yeah, now it's a baby formula shortage.
Yeah,
Yeah,
And it's, which can affect all these babies' lives, and
yeah,
so that's just to show you how it is still going on, how
yeah.
the activity is still going on.
One thing after another, I guess. But Sylvia, I was gonna ask you a question now. I can't remember what it was, but let's see. When did your grandma die? What year was it?
um,
Was it 2020?
2020
Yeah.
when it was first coming in as this after the summer.
Oh, okay. So it was kind of early on.
Yeah, it
Well, then it
was.
must have really been a shock, like what is going on? So,
Yeah, that's when everything was coming through, and nobody really knew what it was at the time, and until things started coming in, and it's just like one after another. That's when I think started hitting in 2020, and it's just like, this is real. I mean,
It started picking up,
the
yeah,
time there was no vaccine yet or anything. I don't think.
Yeah. The vaccine made a huge difference. So how do you feel now about there's this sense that COVID is over? I mean,
I don't think it's,
Yeah, it's not over. Yeah.
no,
and
I mean,
why?
they might say it is like little, I mean, you don't have to be as much, how do you say it, precautious about it, but I mean, everybody has their own how they want to take it, but for me being in this, that had a family member that passed from that, which shouldn't have happened, it's just like you take it differently.
Right, absolutely.
And I guess until you
Agree.
experience or anything like that, then you really know, hey,
Yeah.
this is real. This is not something that's just out there or they're just saying a name or something about it. Then you know the difference between, how do you take it? Which precaution do you go? You're gonna take it, the right way, or you're just gonna, oh, I'm just gonna live a normal life, which
Yeah.
I think will ever be normal soon. It'll be a while, like a long while.
Yeah.
So
Yeah.
that's how I see it.
So rolling the
So,
dice, rolling the dice. Yeah.
well, both of you have kind of used the phrase or brought up the idea that it didn't have to happen. So what's behind that? Why do you feel that way?
I feel that way for the reason being, it was probably just weeks before Lily, he got COVID February 1st, and they had the shots available in March.
Mhm.
And so it was weeks before, and I think they opened up. I think they opened everything up too soon. I kind of feel like they should have kept it closed until the shots were available before they started opening things up to the public. And until so they had those shots and immunizations and then start opening things up. That's kind of how I feel about it.
Yeah. And Sylvia, why do you feel like it shouldn't have happened?
Well, as for me, because early on when it came in, nobody knew. Nobody knew anything. I mean, they try to compare it, I guess, from the flus from back, happened
Yeah.
back years ago. And it was, I mean, not even, I think the numbers were close to what we're hearing now. And when this came in, everybody was like in shock, like, what's going on or what is it? Or, how do you take it? And, it's like, okay, I don't want to be out. I don't want to do anything. We're just going to be home. So, I mean, it's just like, I don't know. I just see it as something, I don't know how it came here, how it was made or what happened, but I just think it should have never happened.
Yeah.
People had long lives to live still.
Yeah. So it's kind of the shock of just like who was expecting this,
Yeah, nobody
heart
was.
attack maybe, or
Yeah,
some
that's different. I mean,
cancer.
that one, I mean, if they were, sick or they had, all these taking a lot of meds for something, they knew what they had and stuff like that. That's different because things might happen eventually, their lives or anything like that. But with this one, nobody knew. I mean, it could have been me, it could have been someone else. You just
My
never
son, he
knew.
was 20. Yeah, my son,
Yeah.
24, healthy, Yes, absolutely.
And that's how my grandma was. No meds, healthy, no meds, just I think she'd probably take even maybe vitamins the most, but no meds, nothing.
Wow.
Everything was good. So
Mhm.
that's what I'm saying. You just never know.
Yeah. Yeah, absolutely. So I remember, I was talking about how I was coming back from Arkansas in mid-March, and I took a picture of my laptop because I opened it and the homepage of the Washington Post was there, and it had this big banner headline that said, daily life comes to a standstill as states attempt to, contain the virus. And I was like, oh, is this what's happening? And it is what happened, and to some extent, it is still happening. So, I think it's fair to say that, yeah, nothing like this we haven't encountered anything like this. So,
Oh, and we don't know what the future is going to hold. It's still out there, like again, and hopefully, it can be contained and we can save others.
mhm, yeah. Yeah, and it's like I said right here. Well, I look, of course, because of this, I look at the stats, the statistics on COVID all the time, like every day, and they're rising in a lot of places. The cases are rising,
Mhm.
but deaths and hospitalizations aren't necessarily rising. They are in some places, but not everywhere. which means that that kind of gives, like, for example, here in Harris County, because of that, they haven't raised the like threat level. And
Right,
because of that, they're not, people and organizations, companies are not changing their policies.
right. Because if
So,
you don't die from it, then it can't be that bad. So you can get it right now and just,
yeah.
hold on. It's kind of like their motto, which, if you've had your shots and your vaccinations, it's fine. But if you still have them and you get sick, you could still, and you have underlying health conditions. I mean, I'm a diabetic, it's just crazy. I mean, you really don't know. Here I am, I've got diabetes, and I was in taking care of my son for a week in that hotel room,
Mhm.
and he was healthy and strong, and I didn't get it.
Mhm.
And it's just it's rolling the dice, and even with these shots, and I don't know maybe the variants, I mean, to be like, we don't know the repercussions of these variants once you get it later on. You do have COVID, how it's going to affect you later on. Of course, we all are going to die. We know that. We just don't know when, and it's just hopefully not from this.
Yeah. And then there's long COVID, of course, which is, I mean, I just
Long
feel like
haulers.
the more I learn
Mhm.
about COVID, the less, like, I don't, even if it's mild, right? Even if it's just like a cold or just like the flu, I don't want to get it. I don't even want
Right.
to mess around with that because we just don't know, like you
Yeah.
said.
And
So,
unfortunately, I think that's not going to be, I think everybody's going to have it at some point,
it seems
in
like
their
it right now.
Yeah, you can't help it.
Yeah.
It's that far out there. You might not know it. You might have had vaccinations, but yeah, hopefully, yeah, if you've had your vaccinations, you got your shot, it won't be that good, bad.
Yeah. Yeah. Although there are still some people who are passing away even though they've had all their shots. And
Yes,
I'm
absolutely.
assuming, I have not been able to find statistics on who those people are and why that's happening, but they may, be people with underlying conditions. So, which is probably,
Or
um,
they haven't had their shots. Yeah. So,
yeah.
um,
So,
studies and trying to figure it out without public, chaos. And trying to get everybody's just wanting to get back to normal, and that's understandable, but you have to get back to normal in a positive way, and not just ignore it.
mhm,
Yeah.
yeah, yeah. What do you think about all that, Sylvia? That's a lot of stuff we just talked about, but
No, it's true. I mean, everything you guys are saying, it's true. I mean, it's gonna take a while, or go the right way, go the right route, and just take your
Yeah.
precautions like you're supposed, how you want to take them. And if I guess, like, if they say you get it, you don't get it, you might have had it, and you just never know, which that's true too.
mhm. And I find that it's difficult when I go someplace and I'm the only one wearing a mask. I really just want to take it off, because I
Right.
feel
Mhm.
it's almost like you're back in third grade or something. I just feel so, um, like I'm sticking out like a sore thumb, like what's wrong with me?
I'm gonna bring back,
So,
a memory, what, after my son had passed, probably it was like, the summer of 2021. And I had my mask on, and I had gone into a Walmart, and I was in the, photo area, and I'm standing in line, and this people were talking about, I don't know why people are still wearing masks.
mm,
I've never heard of anybody who's even had COVID at that. And so I just, out of nowhere, so I do. My son, and I just went off. I was like, my son, who was 24, who just passed, and and this guy was just standing there. He didn't know what hit him, and he was just like,
yeah,
he takes his mask, puts it back on.
yeah,
But it was like it was just like I was appalled that people were standing around literally complaining about COVID still, because they didn't know of anybody who'd ever had it, and they didn't think it was real. And I had to, voice my opinion. Well, let me tell you, you
yeah,
still have that. Unfortunately, here it is, 2022. You still have people, who are out there like that. It's incredible. Don't wear the mask. But yeah, I'm still wearing the mask. I think I have a box full of masks in my car and hand sanitizer, and every time I go anywhere.
Yeah.
because it's all it takes is one cough or, something. And
Yeah.
I do not want to, my son suffered. He suffered. It was a very, I mean, it hit his lungs, and then it hit his kidneys, and then it hit his heart, and watching him suffer, I just realized, I never want to, if I got COVID, I just would rather die another way. I just do not want to die of COVID. It's just such a brutal, horrible death, and then watching him do that, to suffer like that. And some people, it's very quick. They can get it and they can die. And some people, they can, like I said, he was healthy, so he was a fighter. And then some people can get it and it might be just like a cold, and it's just like rolling the dice
Yeah.
and doing. So hopefully all you can do is be the best and kind of put things out there for you, out there to other people. Keep your mask and take care of yourself.
Yeah, and when you take care of yourself, you're kind of taking care of other people too. So,
Right? Absolutely.
like I said, I think that's the lesson of COVID,
Mhm.
is that we need to take care of each other. So, but viruses are kind of scary things. I remember my dad always says viruses aren't alive, and
Mhm.
it's true. It's like they're little machines, and that's just to me such a scary thought. But they're here, what can we do? But what we can do is try to mitigate transmission of the disease as much as we can. And it's like I was saying before, people who aren't vaccinated are like petri dishes because the virus is going to come to them to see how
Mhm.
it can, do its work and possibly mutate, possibly become a variant. So that's a big problem. So, um, and I remember when the governor of Florida, remember he was with some high school students and he said, and some of them had masks on, and he said, take those masks off, which
Right.
is pretty extreme, but
Right. Mhm.
you know,
Yeah, I think that was a Florida one, right?
yeah, that was the governor of Florida said that. So, you know,
Hmm.
people should be, I don't want to like, go too far with an opinion, but people should be free to do what they feel they need to do. They're not hurting anyone by wearing a mask. So,
Right.
um, I mean, even if I go to the bank and I know that they need, they take my ID, I'll just pull it down so they can see my face, but that doesn't mean I'm gonna like take it off and keep it up.
Right.
So. But so did you guys have, any final kind of thoughts or feelings or opinions about anything related to COVID?
Oh, I'm having an opinion every day. You know, it's as you watch it, when you're looking and watching the news and uh, sites and seeing how it's affecting different countries and people and things. And I guess it's just, after being a witness like how I did, it's my opinions are a lot more stronger, than the people who have been blessed pretty much not to have suffered or know anybody. And so, of course, their opinions are going to be completely different. It's very, very hard to try to instill the importance of it to somebody who might not understand because they haven't had to suffer or know somebody who suffered from it. So, yeah, it's different things, different opinions every day.
Mm, yeah. Sylvia, you have any final thoughts?
Same as what Lisa said. I agree with everything she said. It's just where, why, and just, I mean, that's it.
It actually, these conversations have helped me to understand it a little bit better, that sort of bewilderment because like I said, COVID grief being sort of different from when you talk, and I understand a little bit better now. It's because what is COVID? Where did it come from? Why did
Still
this
out there,
happen?
yeah.
Why is this the thing that took my loved one? So, yeah,
What could we
'cause-
what could we have done to prevent it? What can we do to prevent it? And these are the questions we're asking ourselves every day. Was there something we could have done more? Is there
yeah,
something we can do more for? These are questions, that are happening every day, especially when there are people dying still every day, and they're coming new onto the wall. It's still happening. So you realize it hasn't gone away. Mhm.
Right? No, it hasn't. And as far as kids go, the girl Anna, who was the daughter of the woman
Amber,
who
yeah. Mhm.
runs Amber, who runs that Facebook support group, apparently she went very quickly, like the disease progressed really quickly. And we have another girl on the wall who died when she was 12, and it was the same thing, her mom
Yeah, like
told
within
me.
days, yeah.
Yeah,
Mhm.
she told me she had, like, on Friday when she came home from school or whatever, she had a fever, she didn't feel good. So her mom like put her to bed, give her aspirin and so forth, and by the time Monday came, it was clear she was sicker than they thought and she had to go to the hospital, and like that night, like late that night, she passed away. It just went so quickly. And I just can't imagine that, but those are the stories of COVID, and as painful as they are, that's why, again, like I said, we would love to have more people tell their own stories, because that's what people need to know about COVID, that it's not a joke, it's something very serious.
Out there, and still very serious. You've got to be careful, especially the young ones, your little ones, because they you are responsible for your young ones, they can't make these decisions. And as a parent, you need to be responsible for your children, you need to be responsible for these decisions. This is their lives. If you decide not to get your shots or whatever, that's, fine, but you're putting your kids in danger. And, these children, they have their whole lives ahead of them, and worldwide epidemic is not how we see our children dying,
Right,
whether
right.
they're young or they're old, or for anybody dying. A
Yeah.
worldwide epidemic. It's crazy. Ah, sorry.
Yeah, that's like what my husband was talking about before, the kids who are orphaned because their parents, um, didn't take precautions or whatever and ended up passing away, which, you can't blame people for, their own death, but those were just the circumstances, and that's
Right.
very COVID, a story that you
Well,
hear over and over with COVID.
and right now we've come to, now the immunization's out. Now there's medicine for it. Now that they have everything, we have it all out there for us now to keep. So it's a little, it's a lot safer than it was. And all we can do is keep the memories, keep things in the past happening again. Something like this ever happens again, to make sure that before we're open to the public again, to make sure that, we're immunized, and that, there's precautions taken before we open up the doors in the public to people, Um, I have that fight, is money or your life? Well, what good is money if you're not alive to, to enjoy it,
Enjoy.
so especially if it's affecting your children.
Yeah, yeah, absolutely. So, well, we still have about 13 minutes left in the hour, so we can keep chatting or we can take a break. It's up to, because Lisa, Sylvia, she signed up for all 3 hours, so she and I are in this together
Yeah,
for
I
Yeah,
see she was
absolutely.
on there all morning. She
Right.
probably needs a break at least, just to clear her mind
Yeah,
real quick.
I'll take a small one. I'll take a small
Yeah,
one here. I'll get back
yeah.
here in about 10 minutes. Okay. I'll meet you
Okay.
guys back here in 10 minutes. All right.
Okay.
All right. I'm
Yeah,
just gonna close the window.
sure. Yeah. Oh, and here comes somebody from our next, and this is actually my dad.
Oh,
Yeah.
well, I appreciate you having me on here and keep having, the COVID wall going and it's growing little by little every day, which it's gonna keep growing
Yeah. Well,
in
yeah.
time.
I mean, a million people, you know, we always say that our goal is to honor everyone on the wall, just because there's not because we can,
Yeah,
but just because everybody deserves to be
yeah,
remembered,
yeah.
So we don't want to say, we'll get to 20,000 and that'll be it. No, we want to keep going. Hi, Noel.
Well,
So we appreciate you being here. So we just had some extra time still left in this hour, so we were talking a little bit about, and Sylvia, this is Noel, my dad.
Nice to meet
So,
you.
yeah, my cousin was in the first hour, and so I had some recruits from my family, which I appreciate. So, and how are things going where you are, Dad? Are cases going up or
Oh, yeah.
yeah, yeah.
There were 5,000 new cases in New Jersey 2 days ago.
Wow, that's like old time
Yeah, it
COVID,
is. It
you
is.
know? See, that's like what we keep talking about. It's not going away, you know?
No, it's definitely not going
Yeah.
away.
Wow, that's yeah. So, well, I don't know if you've been watching, but the live stream, but Sylvia, as you can see the photo of her grandma there, she lost her grandmother to COVID, and I was saying how it was very clear both from the story, the obituary that you entered, and from all the comments from your family, what a really strong character she was. And so I was saying how that really sort of validates what we're doing, that we're able to keep those people's stories, like store them. And again, as I said, because the Library of Congress is also archiving them, her story is probably going to be in the Library of Congress forever. So, which is an amazing thing. So, and it's an amazing honor that they did that for us. So, but they have all different kinds of websites that are, they're taking snapshots from to store in the archive.
So where can we go find, like, read about it or find
It's,
information on it or anything,
yeah,
like just to get updates on it or read about it?
yeah, I don't know if they have like an update mechanism, but it's LOC, Library of Congress. Let me see if I think I have it bookmarked. Hang on, let me just look and see without going to Facebook, because every time I go to Facebook, we get the feedback. So I'm not going to do that. Let's see. The only thing is, though, I think that they've been having some technical difficulties. So I don't know how much of our site right now is there. Okay, here we go. Let's see. It's
Mm-hmm.
loc.gov.collections/coronavirus web archive. And while I'm here, I'm just going to see if they have anything new up on us. Yeah, I don't see anything. They've been having some trouble getting, the snapshots from our website, and we're still working out why that's happening. But yeah, just keep checking back.
Yeah, just to kind of just look into it or just read things about it. And
Yeah, and it's interesting to see the other website, because some of them it's like the American Postal Workers or something like that, and I'm like, what does that have to do with coronavirus? But the things that they've taken from their website are COVID related, so it's just really interesting. So, I guess library science is interesting anyway. So, um, yeah. So, Dad, we've been talking a lot about the phenomenon, like I've noticed that sort of like there's a COVID grief that's kind of different from grief that I've heard people express otherwise. And I think it's come out in the conversations that that's very much because there is nothing, you may die of a heart attack, cancer, or even like a car accident, something like that. We know these things, they're known quantities. COVID came out of nowhere, and here it is just, taking, loved ones' lives. And I think that that's what it has a lot to do with, and where the sort of a lot of anger comes from. So,
Yeah, I mean, it's a nightmare disease. It's science fiction disease.
yeah,
You
yeah,
can't, you almost can't make this up. The things that it affects almost every organ in the body. It's unpredictable. Some patients get only mildly ill, others die,
Right.
and nobody knows why. And now we're in the third year of it. I mean, it's out of a science fiction novel in many
Yeah.
ways.
Sylvia, do you think you kind of worry more about COVID because, you lost your grandmother? Are you more nervous?
Not nervous, it's just now that we know about it, kind of more or less know more or less about it, just taking more precaution, wearing our mask still with hand sanitizer, wiping down cards and stuff like that. It's just taking more than what we knew before.
Mhm.
So, I mean, we still do the same routines, even with the kids, them, one of them going to school, it's all the same precautions. Same thing we're doing before, you still do it just because they're saying, it's low here, low there, or it's not as bad.
Mhm.
You still take it, until we know that it's clear for you guys, but when it, as of now, it's still not, even though they say it is, but
Mhm.
we still take all the precautions, wiping stuff, doing this, everything we've done before, everything's still the same. Nothing has changed for us. And I mean, we'll do it as long as we can or as long as we have to, and
Yeah.
just keep going.
Mhm. So do
Well,
you, yeah, go ahead.
previously you were talking about the stress induced by trying to make decisions about what to do. It's so hard to make decisions, how to live your life, how careful you have to be. I mean, it drives me crazy. That's,
That's where I get it from.
well, yeah, but
No, I mean, I was saying the uncertainty.
yeah, the uncertainty is one of the worst things about this,
Yeah,
is you just don't know what to do from day to day.
yeah,
And I don't know how long it'll take to really get all the information on this disease. And then it's constantly changing.
yeah,
It's, the variants they have different properties.
yeah,
And so it's just like I said, you couldn't come up with a worst case scenario for a new disease spreading around the world.
yeah. Lisa, this is Noel. I'll introduce
I,
you as well,
I know.
also known as Dad.
Okay, hi,
Me.
Dad.
Yeah, so
or GPA.
Jeepa, yeah, that's what my daughter, yeah, calls him Jeepa. Yeah, Jeepa and Jima. But yeah, and oh, and by the way, when our new blog is finished and it comes out on the website, one of the first things also that I'm going to be posting is I actually found a volunteer specialist in like virology and vaccines, like a PhD. He's retired but taught in was a college professor and everything, and he has put together a really simple explanation of how some things work, like how vaccines work, how the virus, invades cells and makes people sick, and so on and so forth. So I'm really looking forward to that. So, although he's got a lot of information there that is way up on this level, and I'm like, doctor, you need to bring it back down to where I can understand it. So we're working on it together, but I'm really, excited about that. And that should be by the end of this week. It should go live. So
Great.
yeah, yeah. I'm excited. And if you guys go to the website regularly, like you say, then you'll see it. The news page we had, the Observer, we're retiring that one, and we're going to have like a more kind of mainstream blog. So I think it'll be good. So
Yes, absolutely.
yeah, so it's coming up
Keep me
on one
informed.
o'clock. Sylvia, you're free to hang out, but I don't want to keep you any longer than you anticipated. And we're just waiting for one more person for this hour. So like I said, you're welcome to hang out. So
Okay, well, I appreciate you guys having me on. I thank you for inviting me in, and I mean, for the future ones, I'm glad to join again. If you ever have more coming in down the line, I'm open for it. But I will log off and I'll keep watching on the live.
All right.
Nice
Thanks,
nice to meet
Sylvia.
you, Sylvia.
Thank you. Nice meeting you guys. Bye.
You
Bye. Take
stay
care.
well.
You
Yeah.
too.
Okay, so we're just waiting on Bert. And you were, right, Lisa, you were in the like rehearsal session that we had with Bert. He always has trouble getting his video on.
Oh, yes. Okay.
So if he can't handle it, and he's the first reader, so we may just jump ahead because the order that we have is Bert, Lisa, and Noel. So we might kind of switch those around until he gets his video straightened out. Um, and it's a mystery why that happens. Although then he has his cat go across the desk. Maybe the cat has something to do with it. Unlikely, but you never know. So we'll give it, let's see, it's 12:59, so we'll give it another minute or two. And I'm just checking my email to make sure there's no message from him saying that he's having trouble logging on or anything like that. So just give me a second. And so how's the weather out there, Dad?
Well, the sun came out.
All right.
Sort of, it's still pretty cloudy, but it's better than it was yesterday and this morning.
Yeah.
But tomorrow is supposed to be a bad day. There could be really severe storms
Oh, wow.
in the afternoon, tornadoes.
Oh, God.
Even.
See, Jersey is not an area that I think of as having that kind of weather, but you guys have had hurricanes and
Yeah,
superstorms.
the weather is terrible everywhere now.
Yeah.
There's no good place.
Yeah. So, hi, Bert. I don't know if he's connected to audio yet, but well, I was just theorizing that it might be your cat that has been sabotaging your video. Because that sounds like something a cat would do, right? So, and if you are trying to talk to us, you're muted. All right, I think we'll give him a couple minutes to get it together. And I don't know, Lisa, oh, wait, is he?
He's gone.
No, there he
There he
is.
is.
Bert, you're muted, Bert. There you go.
So I started to join at 1/4 till,
Oh, gosh.
and I got the message, can't do this. You'll have to restart your PC. I restarted my PC. It took me this long to get back on.
Oh my goodness. Well, thank you for persevering. So, and this is Noel and this is Lisa. And Noel, of course, is the author of the book about Gigi Grice that the first time I met you, you mentioned, or I guess my husband told you that, yeah, because he knew you were into jazz. So, anyways.
I know.
Hi.
So, are we ready to get started with another round of names? And Bert, you will be the first to go on ahead.
Hang on just a second.
Sure.
I'm still
Your computer's still.
getting everything opened here.
Okay. Yeah, I find I do that, and then once I have everything open, the computer gets so slow. Before this, I was like going through closing everything that I didn't need. Because the last thing I wanted was to block the flow of Zoom.
I switched from Chrome to Safari, and my computer is working much better now.
Yeah, I have done that in the past, and I may switch over because I was having problems with some functions, some processes using up a lot of my CPU. But anyways,
Maybe that's what I need to do because I have Chrome. Chrome's been pretty good.
Yeah, it has, but lately, well, I need a new computer anyway. But I'm just trying to put that off because I don't know to deal with all that entails.
yeah, I've had several computers just die, like that was it, and so I had to get a new one. So Bert, are you ready or are you still
I,
opening
I,
things?
no, I am ready, and I probably
All
better do
right.
it before something else bad happens. The first one on my list is Robert J. Abizzi from Kittery, Maine. He died at age 70. He was a U.S. Army vet. Then Kirsten Catherine Owero, age 20, from Bryan, Texas. She was a sophomore at Texas A&M, valedictorian of her high school. Volunteered for the National Suicide Hotline, which motivated her to want to become a psychiatric nurse. She had a passion for helping others in need. Daniel G. Ball, of 41, of Lincroft, New Jersey. Eugene P. Barnum, 83, of Fort Wayne, Indiana, a U.S. Navy vet, quality control supervisor for member of the Elks American Legion Fraternal Order of the Eagles. This next one is going to be pretty interesting, I think. Marjorie Blackman was her name. She died at age 67 in Seminole, Florida. She was a victim of the, see if I can expand this a little bit. She was a victim of the notorious nursing home in Florida that was overwhelmed by coronavirus. You may remember this story. It was a story on PBS Frontline. She was a licensed practical nurse at the Seminole Pavilion Nursing Home, where the staff had begged managers for protection as the virus raged through the state in April. This was 2021, or 2020. I'm sorry,
Yeah.
2020. They complained that they couldn't get gowns or N95 masks or even answers to their questions. They saw their ranks diminishing as one after another came down with the fever or symptoms, but the facility kept accepting hospital patients for rehab who hadn't been tested for the virus. They kept accepting them until April the 9th, 2020. Though some state officials and nursing homes raised concern about the practice weeks earlier, the state took almost 2 months to mandate testing. By April the 16th, 2020, 33 patients and 5 employees had tested positive. The week of April the 28th, Governor Ron DeSantis, you may know him.
Mm-hmm. We were
uh,
just talking about him.
I heard that. After weeks of pressure and a lawsuit filed by several media outlets, began requiring long-term care facilities to report positive COVID cases and deaths to the public. That same week, Marjorie Blackman, who had cared for patients who had COVID, died from COVID herself. On July 7th, 2020, after about 2,000 Floridians from long-term care centers had died from the virus, the state began requiring those centers to test staffers every 2 weeks. Testing became easier the next month after the federal government sent kits that could get results within 24 hours. That's just a horrible, horrible story. Marjorie Blackman, licensed practical nurse, died from taking care of COVID patients who, in a preventable situation. Bonnie Louise Brandt, 75, of Oswego, Kansas. Ann Grady Granum, 58, of Blythewood, South Carolina, a surgical technologist. Jackie Leon Cook, 75, of Concho, Arizona, retired Army. Jack S. Gruber, 76, of Silva, North Carolina, OBGYN doctor, faculty member and department vice chairman of the Wright State University. Laura Ann Troxler, 75, of Smyrna, Tennessee. And Marnie Zhuang, 31, of St. Paul, Minnesota, a child of Hmong refugees. She was chair of the St. Paul's School Board. And that's the end of my list.
Thank you. Thank you for all those details. And you had quite a few healthcare professionals on your list.
We know that they were hit hard.
Yeah.
And I hope that we don't forget them too, that because they've really gone above and beyond the call of duty during this crisis. Amazing. I've had, because of taking care of my mother as she got older, I've had some experiences with the medical profession, and not all of them have been great. And as people, you know, as we know, the medical profession has problems. But I'll tell you, I've been very impressed by the medical profession, nurses and doctors and everyone. It's not just those. It's the people who in housekeeping. Everyone who works in hospitals has been under great stress and great threat these last few years, and they continue to go in and do their jobs,
Yeah.
knowing that the risk that they're taking. These are wonderful people.
Yeah.
These are people who are called to their profession.
Agree. All right, Lisa.
Okay, first I have it, Lindsay A. Fleece, I believe that's how you pronounce it, age 37, from Cedar Falls, Iowa. And that's right. And Darren Adams, age 51, Detroit, Michigan. Albert Barber, 39, from Detroit, Illinois. Timothy Branscombe, age 32, from Chicago, Illinois. Albert Barber, did I say that? 39, Detroit, Illinois.
Yes.
And Brielle Charlene Butcher, age 13, from Marion, Indiana. Ronnie Lee Gardner, from age 58, Victorville, California. Dan McNerlin, age 70, from Gurley. And it's, I'm not sure what the state that is.
Nebraska.
Nebraska, sorry. Sharon Parker, age 60, from Albertsville, Alabama. Keegan Hunter Thayer, age 22, from Logan, Utah. Kimberly Grace Perez, age 57, from Calmite, Michigan. That's the end of my list.
All right. Thank you. All right, Noel, you'll be finishing us out, and then we'll have a little chat, and we'll finish early for the day. So please.
Okay, my list is geographically oriented. I live in New Jersey. I'm sitting in New Jersey at the moment. And New Jersey, as of a few days ago, had over 33,000 deaths from the disease, COVID-19. And this list is confined to the two towns in which I live. And I actually do live in two towns at once. That's a long story. Glen Ridge, New Jersey, and Montclair, New Jersey, which are adjacent to one another in northern New Jersey. So the first person is Catherine Coughlin, age 70, a resident of Glen Ridge. She was a dental assistant, bookkeeper, and office manager. Priya Khanna, 43, of Glen Ridge, New Jersey. She was a physician, a nephrologist. Charles Roberts, 45, of Glen Ridge, New Jersey, and he was a Glen Ridge police officer. Lona Mae Irwin, 96 years old, of Montclair, New Jersey, and she worked in the hospitality industry. Alan Hobeck, 82, Montclair, New Jersey, retired Army veteran, and IT consultant. Wilmer Ulysses McPherson Sr., age 84, Montclair, New Jersey, retiree from the United States Marine Corps and a helicopter mechanic. And probably the best known person on the list is a musician and composer named Adam Schlesinger, age 52, of Montclair, New Jersey. He was also a producer and the co-founder of 4 different rock groups, very well known in this area at any rate. And Ruth's sister, younger sister Claire, knew him. I think they might have gone to high school together.
Yeah. Mhm.
Yeah. So that's my list.
All right, thank you. Wow, I can't believe 33,000 deaths in what period of
That's
time?
since the beginning.
Wow.
So
Yeah.
two and a quarter years or so.
Yeah, that's
Yeah, I
incredible.
think New Jersey also has one of the highest per capita death rates.
Yeah.
It's
It's
a
also
very high density population state.
it's actually
which-
the most
Yeah.
densely populated if you take out DC.
Yeah.
Yeah. So, like I said, I know my stats. I pay too much attention to COVID. So Bert, I don't know, have you been watching any of the discussions that we've had about grief and about, did this have to happen and all that? So, do you have thoughts about those topics?
I have listened. I've had the feed on since you started. As a matter of fact, I haven't always been in the room, but I've had the feed on. So I did hear some of it. Somebody I think mentioned the flu epidemic of 1918,
Yeah, I did. Mhm.
and so I was just curious about the statistics from that. By the way, I lost an aunt in that
Wow.
epidemic. There were 50 million died from that epidemic worldwide. And in the United States, it was 675,000, which is less than the million that we're at with COVID here. But I guess if you adjusted it for population in terms of percentage, I don't know how that would play out.
I love your cat.
Everybody's trying not to laugh at the cat.
That's my cat seems to know when I'm on Zoom, and she comes around.
He wants to be a star.
She's a ham.
Is she? Mhm.
So I don't know, but we must be about on pace with the flu epidemic of 1918.
I'm actually going to look up the number right now, the current, because it's on our website. Our website has a page called the Daily Count, which is synced up with the New York Times database. So when they update, we update. So let's see what the number is, because there's a lot of places that have been saying, like as of last week, we hit 1 million. But the New York Times still says 998,301. So
Okay.
you can say approaching 1 million or something like that. So,
And they went through a lot of-
It's more than 1 million, it's more than 1 million. So,
and we know that it's way underestimated
yeah.
exactly.
or underreported, I guess.
Yeah. And
And
now, go ahead.
they went through a lot of the same problems during the 1918 flu epidemic that we're going through with this COVID, of people thinking that masking was a conspiracy, and
Really?
and refusing to wear masks and so forth. So human nature apparently accounts for a lot of this. The thing I don't understand, I guess, is about wearing masks is, okay, whatever your beliefs are about what kind of freedoms you have, and I think people who claim they don't wear a mask because they're free and don't have to, seem to misunderstand the concept of freedoms in the United States. But it's not just for you, it's for everyone else, you know. You're protecting them from getting infected if you happen to be carrying the virus. I don't understand why people don't do it for other people.
Mhm.
Mhm.
And of course, there's a condemnation in that lack of
Yeah.
understanding.
Well, it got politicized right from the get-go.
Sure
You
did.
know, so that didn't help at all. It just added another element of irrationality into something that really required people to think about what their behaviors were going to be, you know, and as you say, take into consideration not just their own health, but the health of others, you know, and that got kind of lost in the arguments, kind of bogus arguments about freedom, what freedom really is. And it's really, I mean, our whole response from the very beginning was inappropriate. And well, I mean, a lot of it was because of lack of knowledge. It was, you know, a new disease and we didn't know much about it. But it seems like we've made every decision that we possibly could to help spread the virus, you know, to not keep it in check. And it's just inexplicable to me
Yeah.
how we could be, how we could have done this, you know, to ourselves. So
Lisa, what do you think about that?
Well, it started out at the beginning, yeah, at the beginning, because we didn't know that much about it. I mean, again, like when my son had COVID and we had that week, we didn't even know what to do, you know? We just need quarantine. First we did wear the mask and so on. And if more goes out there, I think people get too comfortable. I still question people as far as we've come so far with the immunizations, the ones that still haven't got their shots out there. I don't understand that. Yeah, it's going to be a struggle until everybody gets immunized. I mean, it's going to continue to, they can be carriers and it's going to continue to pass on to other people. And it's very hard to comprehend that people don't understand that. You know, just get immunized and, you know, we could all have a healthy life.
Yeah. So, now I forgot what my question was. It had to do with Dad, what you said about, you know, that it seems like everything we've done has been for the opposite, you know, reason that it should have been. And the CDC, I have found, you know, to the mess, I don't know if they just have not great messaging or what's going on with the CDC.
I
but-
think that woman, Rochelle Walensky, is too emotional.
Mm,
She, you know, I don't think has the, I mean, bureaucrats have to have a certain amount of coldness, you know, they have to not be, you know, wearing their hearts on their sleeves, you know, and I think she's just too emotional in some of the decisions she's made and then rescinded. And that's the worst possible thing because that just sows confusion. But again, I can't blame her really because the knowledge is just not there, the full knowledge of what this does and how it does it. And another thing is the vaccines. Certainly somebody eventually will win the Nobel Prize for the development of these vaccines, but the fact of the matter is that they don't last long enough. They really don't. We're going to be, you know, essentially having to, the way things are going right now, we're going to eventually be taking 2 to 3 shots a year, everybody. That is a massive undertaking to give out that many shots, and it will cost a fortune. But that looks like what's going to happen because of the way this thing mutates and the way they wane after 4 to 6 months.
Yeah.
So that's going to be a real concern going forward.
I don't know, Bert, what do you think about the CDC and all of that?
Well, I do think they've had a communication problem. And part of it has been just kind of a naivete on their part that they haven't. It's a very science is complex, and as you get new facts, new findings, things change, and your recommendations have to change. But they haven't communicated. They needed to like give the United States citizenry a basic course in scientific research, so that they would understand how that works. When you come up with new findings, that doesn't mean that you were lying 6 months ago. It just means that you know more now than you did then. But people have developed this mistrust of whatever the CDC says, as if they're part of some conspiracy out of the basement of a pizza parlor in Washington, D.C. that ran child porn ring. So I think that's part of it. But at the same time, I'll tell you, Fauci has been just great, although he's been criticized along with everybody else because of the misunderstanding of the difficulty of what he's doing. But Fauci has been really, really good.
But he's been more than criticized. It seems like he's been pushed aside. You don't hear him so much anymore. And again, this goes to the politicization of the whole thing. He became the focal point for the people that were trying to turn this into an issue, that involves our rights, our freedom.
Turn it into political, made it a political issue.
And he's the one that really became the point. He's the one that got viciously attacked by the Kentucky Senator
Rand Paul.
Rand Paul, thank you. At a hearing. I mean, that was outrageous what Rand Paul did to him.
Yeah.
Or tried to do to him.
Although Fauci had a pretty good comeback.
Yeah.
So Lisa, Dr. Fauci fan or not?
Yes.
Because
Yes, I see.
yeah, he kind of, to
I
me,
think he does his best. He's a doctor. I think he's been criticized. They've turned a lot of it political. And with science, you're constantly testing and trying things. And I'm thinking he's doing his best. He's done very, very well.
how about Dr. Hotez from right here in Houston? Who's a fan of Hotez?
Yeah, he's good. The one that's always going to give you bad news is Osterholm from University of Minnesota.
Oh.
He's I had to tune him out. It just got too discouraging. But Bert, your point about science being hard to explain to non-scientists is very well taken. It's so difficult. I mean, okay, first of all, immunology, which is really what you're talking about when you're talking about viruses, is unbelievably complex. It's just an endless mire of particles, white cells, lymphocytes, eosinophils, all these different things that the body uses, and it's impossible to discuss to explain that subject clearly. The mutations are all chemistry. They're all chemistry. What the virus is doing is just switching out amino acids on those spike proteins. But to try to explain that, to people is impossible.
That's what I was talking about earlier about the virology and vaccine expert that I've,
Yeah.
he's volunteering. And the document that he's giving me so far is 100 pages long. And I'm like, because it's really difficult for him, just like you said, to, sort of, well, dumb it down, basically.
When you start dumbing it down, that's when you get into trouble, because you can't leave stuff out, because all of it is important.
Yeah. Yeah.
But it's just too much to try to get across to 300 and some million people.
Yeah.
You know.
Yeah. But that's his goal, though. That's why he's volunteering with us, because he wants a conduit to share truth. So, which hopefully is something that we're doing.
I mean, I've gone to presentations on medical subjects that were aimed at patients, supposedly aimed at patients.
Mhm.
But these doctors and these academics, they come with the same slides that they show at their scientific meetings.
Right. That's what I have too. Yeah. So, yeah, I find them difficult to understand, but I have an expert volunteering for me, so I'll just keep working with him. So, yeah, I have one explainer based on his stuff already, ready to go to get posted on our new blog about um, what a virus does to a cell. Just the most basic thing. How does it work? So that's, like I said before, that's like the second part of our mission, and it's something that we, whether it's in a news format or a blog format, that's what we want to do, is just inform and educate people as much as we can.
And viruses are not living things.
I know I mentioned
Because
that
that's
earlier.
another point of confusion, because we talk about it like it's got a brain and it's making up its mind how it's going to mutate, to evade the immune system. It doesn't work like that. It's all chemistry.
Yeah.
It's just what it encounters. And the more people that don't get vaccinated,
Right.
the more of a laboratory it has to try different mutations out until it finds the best ones.
Right.
And it doesn't have any legs.
No.
It has spikes.
It's carried around by, but my point being that it's carried around by us.
By
Right.
not wearing masks. Yeah, I mean, we help it out.
Yeah. There seems to be a consensus among all the people that we've had on today about masks. So,
Well, I would think so, but I'm still amazed at how many people don't wear them.
Right.
I volunteered at a library, and it has 2 floors, and I have a need that is kind of been taking the elevator more lately. And of course, I have my mask on, and I get on the elevator, and 3 times recently, someone has gotten on the elevator with me without not wearing a mask, and I've had to get off the elevator
yeah.
and walk up the stairs and let them take the elevator. Really, that didn't seem right.
Yeah. Well, that's like what I've been saying all day, is that, one of the lessons of COVID is how do we treat each other?
Well,
Because
another thing, and I think, I mean, I know we don't want to get too political, and I don't want to alienate anyone, but we were pretty slow out of the gate because of the hesitancy of our president to even acknowledge that this thing existed,
yeah, that's true.
and and he diminished it for a long time as if it was nothing more than the flu or a bad cold, and it would go away and so forth. And what are we, 3rd highest rate of countries in the world for COVID? And I think and this is the United States, we shouldn't be like third. We should be, like, we've got the
27.
best medical system. I don't know whether we
In the
do.
world, yeah.
And we've got a good one, that certainly one that would be able to deal with this.
And unfortunately, right out of the gate is what makes the initial impression and the lasting impression. So that's what, kind of got a lot of people thinking that this was not a big deal,
Yeah,
because he downplayed it. Yeah, it was a total disaster of leadership.
right. Total failure. And it goes on. I mentioned Ron DeSantis of Florida when I was talking about the crisis there. I have maybe I've always been, maybe I've just been naive all my life, but I certainly, we have seen a lot more. COVID is one example of this, of people politicizing issues that they know are false in order to get the support of, to raise the emotions of a certain group of people. They're smarter
Especially if
than
you're
that.
planning to run for president.
Lisa, what do you think about the way things were handled in the beginning?
I think they were done at the time with knowledge that we had, and everybody was, coming with. I think decisions were being made what we knew. Again, I don't like how things down here were handled, only because I think they opened up everything too soon, which led to people, before the immunizations came out, which led, like, my son's death. That's, and I speak for him. Other than that, I try not to get too much into the political side of it, because I'm still in mourning and grieving, and I just try to stay on the facts that I lost my son over this, and it's a horrible thing, and I'm trying to keep his memory and other people's memory alive that we have lost to it. So I'm going to leave it at that.
That's right. And I understand that, Lisa. I have more distance from this. I can look at the political issues, and I can try to look at from a different perspective than you would.
Yeah, I just, I'm still grieving. It's like, I don't care. It's done. Yeah, I've lost my son, and nothing seems to matter to me anymore.
Right.
But I mean, it does matter, of course. It's out there, but that's kind of my opinions at this point. It's just the time,
Yeah.
but it's memories, and that's all we have right now. That's all I have is, memories, and trying to keep that alive.
Mhm.
I think that's part of the reason that, we have tried on the website not to go there, not to get into those arguments, because just like you said, we're focused on what it is that we're doing, which is memorializing people.
Right.
So,
Right.
you make
Keep that
a good
issue
point.
separate. Yeah.
Mhm.
Not to say that it doesn't matter, but these are things that, open up, and these memories, and of course, these are important topics to talk about. But right now, we're going to talk about the memories that we've had, because each and every one of these people that we've had on the wall, and names that I've read and that haven't been read, and people we've lost to COVID, and people who are overcoming it, need to be remembered, and know that their lives matter, and not just to go on with life like they didn't, because they did matter. They did have lives. They did have memories. They had so much to live for, and we have to continue to keep their memories alive, and know that, that their death did not have to be,
Mhm.
These
Yeah.
were people who lived lives, who had loved ones, who had an impact in the world, who had jobs and hobbies and other things that they did. They were human beings, and then that
exactly.
human beings are the most important thing.
Mhm.
I would never have thought in a million years that, I would have outlived my son. I mean, he was a kind person. He was a great, friendly, didn't know he's everybody's friend, you know. He's
Yeah,
a
you
very,
can tell by the picture,
Yeah.
yeah,
right?
he's a sweet 24 year old. Yeah, he's 23 when he got COVID, and then he died a week after his 24th birthday. I mean, he had his whole life ahead of him. I still haven't even been able to go through his things in his room. You know, it's just too hard. And he had so much to offer. And then when I talk to people, his friends and people from on Facebook and people that up in Washington, COVID, he just had so many friends. He made so many people happy. And he had that laugh that you could hear a mile away. And, you know, these are things that I miss and we have to keep alive. And it's important, not just in my memory, but in other people's memories.
Yeah.
You know, your son, your child, your daughter, your cousin, your grandparents, your mother, father, everybody mattered. Their lives mattered.
Absolutely. Bert, by the way, is one of our volunteers. And I guess you're a volunteer researcher because he's one of the people that finds, I had talked about how we use excerpts from some online obituaries. So that's his role, is finding those, going through obituaries and finding the people who passed away from COVID, which is,
Mhm.
it's not a thankless job because we thank you very much, but
So
it's a
that's our job.
difficult job. So, but it does give you though exposure, like we also have, like on the other end of it, exposure to knowing something about the people who have passed away from COVID.
They
So
all have a story. Yeah.
yeah,
Everybody's
exactly,
life's a story. Mhm.
Yes.
exactly. And I keep talking about Alex's picture because it really is one of my favorites on the wall. So
I
he
Yeah.
just
agree
looks
with
so
you.
cute.
Yeah.
Yeah. So
He looks like a really great guy. I wish I'd
yeah.
known.
Yeah, he was.
He
Great
lives
kid.
on with that smile, I'll tell you.
Yeah.
He
Yeah.
was a
Yeah. And that's
great.
another thing that's interesting about the wall is the different, facial expressions, the different kinds of smiles people have, and what you
For
can,
people. Yeah, absolutely.
yeah, and what you can learn about them. So, well, it is 20 of 2. We can keep on chatting if you'd like to, or we can close
I think
early.
I'm going to go ahead and close.
Okay.
I've been here. I've been planning for a while. It
Yeah.
was really great. I got to talk to you later, Ruth. It was very nice meeting everybody.
It was a pleasure
And
meeting you.
yes, sure, absolutely. And I hope we can do this again soon.
Yeah. Yeah.
And you guys have a blessed day.
You too. Thank you, Lisa, for being here for 3
Yeah.
hours.
Thank
And
you.
for all your help in connecting us with the Facebook group. Thank you very
Oh,
much for that
absolutely.
too. So, all right, take
All
care.
right. Bye-bye.
Bye.
Hi,
So, shall we?
Bert, did you buy our book or did you get it from the library?
Your book? Oh,
Yeah.
I bought it.
Oh, thank you.
You're
I
welcome.
think I'm gonna
I
wrap
know
it
I'm
up.
responsible
Okay, sure.
for a whole bunch of income for you.
Okay.
So because then we can continue chatting, but we don't have to, be on Facebook Live and recording and everything. But I want to thank everybody who did come out to watch us, watch this discussion, listen to the names being read. It's something that really is so important. And you can see like how it impacted Lisa, that she, I think, really did get something out of it, which demonstrates to us the value of it, in my opinion. And again, what we'd really love to see more of is people submitting on the website their own loved one's story. So I encourage anyone who has lost someone to COVID, please, go to the website and consider that. So until next time, until the next Read Your Names, thank you, everybody, and have a great day.
See you, Ruth.
Yep. Okay, I'm trying to figure out how to stop recording. Okay. All right. Well, I guess we're wrapping it up. So,
Okay. All
all
right.
right. Thank you so much
Yeah,
for
all right.
coming. All right.
Bye-bye.
Take care. Bye.